On the phone with me right now is Charles Katibi from Wyoming Liberty Group. How you been, Charles?
Pretty good. How have you been?
Very good, and I've got like effects ready for the title of your story here.
All right.
So it's Medicaid's. Do I have this right? Hidden what?
Medicaid's hidden cruelty.
How's that?
That's fitting, actually.
Okay, it's fitting. Okay, there. Don't say I don't have your back on stuff like this.
Oh,
Charles,
absolutely not.
Charles works with Wyoming Liberty Group and studies things like this. What would a hidden cruelty be? Because this stuff is supposed to provide tens of millions of dollars to help needy people. How could it possibly be cruel in any way?
Well, the cruelty of Medicaid is that it's promising health care to people, and it can't even afford to provide health care to the people that currently rely on it.
Wow.
We're promising that if we expand Medicaid, we can provide for all these people, when in reality, it delivers terrible health care now, and because of our mineral revenues crisis, we're not going to be able to pay for it.
So are you actually trying to convince us that government is promising stuff that it can't deliver?
I know, it's shocking.
Yeah,
right?
it is. I'm on the floor over here. Go for it.
Yeah. Well, that's essentially the bottom line. And yet, despite the fact that we can't afford it, and there's tons of evidence that it delivers terrible health care, they're still beating the Democrats and liberal Republicans are still beating the drum that we should expand it, when there's just no way that this could possibly work in Wyoming.
For the record, Charles Katibi just called Governor Meade a liberal Republican to say that.
I did not say that.
No, not exactly in those words, but effectively. He's been pushing the thing.
Oh, yes, absolutely,
Yeah. Okay.
and several others. In fact,
Right.
an entire cadre of special interests under a coalition named Healthy Wyoming have been pushing this for years now. And yet they say they're sticking up for the little guy. They're trying to provide a voice for the downtrodden, when these are the established hospitals, the established institutions of this state that just want to pour more money, more taxpayer dollars into this program that doesn't even help the people it's saying it's for.
Can we start a website called Broke Wyoming?
That would be a good idea.
Counteract that. Okay, let's go through little by little here, because it's more than just patients that are hurt here. So first off, we have to say this will end up hurting patients. Let's deal with that one first. How exactly?
Yeah, well, let's start with the idea. When people say Medicaid expansion will enroll 20,000 people, they want you to think that those people have no other options. When the thing is that there are thousands of people right now, low-income people, that are on the Obamacare exchange right now, and they're getting private coverage. I'm not a fan of Obamacare, but I think compared to government insurance, it's much better for people if you simply gave them money to purchase private coverage. However, if you expand Medicaid, they will be kicked off their insurance, because under the rules of Obamacare, you cannot both be eligible for Medicaid and these subsidies. So they are getting care through this private coverage. If Medicaid expands, they'll lose their subsidies, they'll get kicked off, and be thrown onto this program.
Well, now, step one is,
Sure.
Does that offer less services to them and worse coverage?
Absolutely.
Okay.
Yes. Yep.
Okay, so step two, if they get kicked off of this. Well,
Yeah,
I mean, I look at the cost to the state, because I don't think the federal money is going to be there.
Oh, it's not going to be there. If you just look at the debt right now and look where it's going, and if you think the federal government is actually going to keep this promise, I've got a bridge in Brooklyn to sell you.
Yeah. Hey, I got a bridge right out here in Campbell County to sell you over a massive lake that was here like millions of years ago. So, okay, that's what it can do to the patients out here. Mm-hmm. But now, doesn't it cause a problem for the hospitals? Let's go big first. Doesn't it cause a problem for the hospitals?
It does, yes.
Okay.
And this is and all we have to go off of is self-reported data. Hospitals actually don't give out audited reports. But from those ones alone, Medicaid only covers 80% of the cost of care on average across hospitals. So hospitals lose money when they serve Medicaid patients. And if you kick people off of private insurance, like I said before, and you throw them onto Medicaid, they will go from paying their way to becoming an unfunded liability on the backs of those hospitals. And that means that's less money to pay doctors, and that's less money to actually provide all the services that make us healthy.
Okay, now we haven't even gotten into, I'm sticking with the hospitals here.
Sure.
So there's going to be people pouring in from other states to take advantage of free stuff, and that tends to overwhelm the system.
That's another thing as well. Yeah. So when you expand Medicaid, you go onto the Obamacare website, healthcare.gov, and go on there and you enroll. But there are no actually solidly enforceable ways to make sure that you're not a resident from Colorado or Montana or Utah or frankly anywhere else in the country. A lot of states have tried actually to put these residency requirements, but the federal government has actually fought them on this for reasons that I'm not completely aware of, actually.
Yeah.
And that helps to contribute to the real cost explosion because it doesn't just hurt patients. Because remember, Medicaid has blown through all the projections in terms of enrollment and costs, and this is going to have to come out of people's pockets one way or another.
Okay, now speaking of coming out, now I've gone from the hospital, talk about coming out of people's pockets. Now we get down to the local doctor accepting these patients, and some of these doctors also work with the hospitals.
Yeah. Well, the thing is that there's a lot of data that shows that if you pay doctors less, they're going to be less likely to treat you. And some researchers at the Centers for Disease Control actually looked at that, and they found that states that pay doctors the least, liberal states actually, ironically, like California and New Jersey, almost nearly 60% of doctors no longer accept Medicaid patients. And the real danger for Wyoming is that we could begin to look a lot more like those states. Because right now we're actually cutting Medicaid's reimbursement rates across a range of different providers. And if you expand Medicaid, you're going to expand that unaccessibility of care to a lot more patients. You're going to be promising a lot more and delivering a lot less.
Okay, so if a patient needed to see a doctor, but the doctors in his town or in the area are no longer accepting Medicaid, then what can the patients do? Where can they go?
See, this is so dangerous because we have a real doctor shortage in Wyoming. They're just, for a number of reasons, there aren't that many doctors as a share of the population, and they're very spread out. This is a very rural state. So if one of your doctors, or God forbid, a hospital in one of these rural areas says, you know what, we cannot afford to keep taking care of these patients, they're going to have to travel, they're going to have to find a way to go to another area, and if not, they're going to be put on a waiting line. And they're going to be put on a waiting list, and this is going to have all sorts of terrible consequences. Because I think people should remember this. Healthcare delayed is healthcare denied.
Right. Well, I just want to add to that, not just delayed and denied, but if a patient has to travel, let's say someone had to go all the way down to Colorado to get this kind of help, a lot of these people are hurting pretty bad, and that kind of traveling is just not good for them.
Oh, absolutely. And remember, these people have some of the least resources of anybody. They don't have that much money to say go down, travel down, maybe get a hotel so they can even just see a doctor. Some of the biggest problems with Medicaid's access is that they make it so hard just to see a primary care doctor. So a lot of the really big medical problems they could be having, they don't even know about until it's too late.
Okay, so real quickly on this one here, because we're running out of time. But okay, so I guess you cruel little twit, you, Charles, you just want people to die in the street, so we're just going to cut them off of Medicaid, and people will be dying without any help whatsoever. Or did you come up with some other solution?
So this is what we've been talking about is a submission I gave to wyofile.com on an online debate on Medicaid expansion. I didn't talk about some of the solutions. This was just on whether it was a bad idea. There are a number of very good solutions, though. My idea is if we actually want to provide health care to low-income people and the uninsured, there are two things we can do. One, we can make health insurance and health care more cost-effective. We can start by getting rid of all of Obamacare's regulations that make it so expensive. And two, once we get health insurance costs down, for the few people that still can't afford it, why not just do the simple thing and just give them a fixed, flat lump sum payment to go out and buy the best health insurance privately for
Right.
themselves.
There you go.
That's it.
All right, you've written extensively about it. Where do people find your writings?
They can go to wyliberty.org.
As always, Charles, thanks for coming on the show. I appreciate it.
Thank you.
Okay, Charles Katibi with Wyoming Liberty Group joining us. And again, wyliberty.org.